The Kent State Twinsburg cohort is the perfect balance for me. With me being able to come right here to Kent State versus going out to the Kent campus, the main campus. I could just go from work. The evening hours are just perfect for me.
The full-time working adult student is very different than the usual university student. They have a lot of times families. They're working full-time. A lot of them are in leadership roles. They have a lot of responsibilities. So we said we're going to meet the needs of these full-time working adult students.
We have people in the cohort program who are all non-traditional, who are all working full-time jobs, many of whom with families. We're all here to support each other, so you never feel alone, you never feel out of place.
The 1 night a week for 2 years works if you're a working adult, a working professional. You can't go to school full-time. It can't be a 2-3 day a week. It can't take up your entire weekend. It's a weeknight. It's very doable on a busy schedule. Even for my classmates that have children, it's very doable.
We know that we need really top-notch leaders, effective leaders for the health system, both the regular health system and in the public health system.
I've been a clinical nurse for 20 years. And so to just get a chance to see how the policies in healthcare is made, and with all the healthcare reform that's going on in the United States, I just thought it would be a good opportunity to really get in on the health policy side of it with my clinical background.
I got into public health because I've always loved health-related fields. I know I'm never going to be a clinician, but I still am fascinated by it and can understand and see the critical role it plays in society.
For being a big school, it really works like a small school. They very much cater. I mean, they immediately assign somebody to contact you and sort of walk you through not only the application process, financial aid, potential for scholarships, and very accommodating. Your professors provide you all their contact information.
All my questions were answered by the Masters of Public Health faculty here. This has been a really good experience.
Great professors. So far, every single one of them has been committed to helping us, and I think it's a quality education. Their years of experience, they sort of mirror our own. We're not rookies out of the gate. We don't want to be talking to someone that doesn't have the chops to teach us, and they absolutely do.
This program in particular is especially good for people who are trying to break in to the health fields, because you're with colleagues that work in the hospitals, they work in the health departments, they work in the agencies that are doing public health every day.
I think this is where, particularly at the master's level, this is where the students are going to be coming from more and more and more from the community. Are the working students looking at professional development, how they can work up in their organizations, and they want to come to places like Kent and get that education.
Now that I've taken this leap, I see that it's just so empowering. Everyone is so helpful, so I want to go back and tell the other nurses about it too.
I think the real world examples help me a lot, not just from my discipline, but we have folks in all different disciplines here in the school, and that helps me think about public health differently.
Coming to the Twinsburg cohort program totally changed my outlook, not only to the program, but the college and to fields I may pursue once I graduate.
It's a lot of different educational methods that go into it, but it's all aimed at the experienced full-time working adult student.